Well, hello, Esther. It's so lovely for you to be able to come and join us and showcase some of your skills. You and I have known each other for a good number of years now. I think it's probably coming up for nearly double figures, isn't it?
Yeah, you came to my life in 2019, which
Oh, is it
was crazy.
2019? It
Yeah.
feels, yeah, it's the 2026. That's a pretty impressive. So
Yeah.
before we go in, and I really want to use this just opportunity that we're sitting in the same room together to talk about your skills and how our skills can work collaboratively. The
Sure.
functional medicine meet the more psychological, full body 360 approach. But if I
Yeah.
can maybe introduce you, and please correct me if I've got any of this wrong. So you are a psychological doctor, Dr. Esther Cole. You have your own business, which is an award-winning business where you have got numerous different practitioners come to work with you. And it's a real diverse practice, isn't it? But you have got some quite prestigious awards through that practice. Specialist Therapy Provider of the Year 2022. You've got your own podcast, Breaking Through Therapy, where you really help to kind of bring to life what you've been doing. You work in London, but you also work internationally because the power of Zoom, that so many of us know, is such a great opportunity. Um, you're the proud BPS Early Career Award winner of 2020. And that one's a really interesting because that was your role um, supporting the psychological therapy pediatric acquired brain injury. Now, I'm going to come back to that one. So
Mouthful.
more about that one, if that's okay. Um, you've also got the prestigious award of Psychological Therapy Specialist Provider of the Year 2022 and again 2024 and 2025. But I think if we really kind of introduce you, so you're a third generation British Jamaican psychologist managing long term conditions whilst being a mother of three. Now, you've had your own health journey through this period of time, and that's where we met each other. But I think that's really sort of shown you the power of physical medicine meet emotional medicine, hasn't it?
Been
Hasn't
amazing.
And I think through your work, you're able to really support the physical, the trauma side to the work, and really tailor make everything that you do to the individual that's in front of you. So everything that's behind you is very research based, very evidence based, but can I just say very real and very alive? And I think that's what people are looking for. You are smart, you're really smart, but you also got a beautiful way with the people that you work with.
Thank you so
So
much. Yeah, I think that's just my ethos in general is that I learn so much from everybody is unique. No two brains are alike and no two people are alike. And
And that's
like,
exactly why I think we work so beautifully synergistically from a functional medicine point of view, because that's how I see everybody. I can be working with two people with the same diagnosis, maybe on the same treatment regimen, but actually their way of handling it is very, very different.
yeah.
So maybe you can really, in your own words, start off by saying, so some people who are listening going to understand what your skills are as a psychologist, but actually I'd really like for you to be able to share with people why might somebody want support of a psychologist such as yourself, especially maybe outside of the remit of the NHS. There's the mental health services in the NHS, which are very limited, sadly.
Yeah.
But why might somebody really need that extra level of support, like yourself or one of the members of your team?
So what I think is really precious about what we do, which is just shutting down my emails doesn't make any noise. What's really precious is that actually the reason I created lifespan psychology is because I wanted to work across the lifespan, which means we work with adults, children, families, and couples. And what that means is that whereas before, you know how services are commissioned in the NHS, it's very, very specific. I used to work with older people, memory services, and that was very, very, very defined. But now I can work with a 2-year-old or a 50-year-old or an 80-year-old, or I can work with a family. And I think that's what's really special about working privately, that you can create a bespoke therapy experience for people that they wouldn't access in the NHS. And that, like you were saying before, not only is it evidence based, but it's tailor made to the individual couple or family or child. So I think that's what's really important. And I think it obviously improves waiting times as well. So you're not going to be waiting a long time. We work primarily with private medical insurers, but we also have a lot of self-funding clients as well.
And maybe if I can draw upon some of those population groups. So children, obviously, one of the areas that you talked about, acquired brain injury. Wow, I mean, that's very kind of bespoke and specialized and amazing. And actually, one of my team who specializes in children has supported a lot of children with acquired brain injury over her career. If we can maybe be a bit more generic around children, and I just came off a call where I was supporting a lovely mum and her 3 children. And none of the children have very specific there's no diagnosis, maybe a bit of ADHD, but actually all 3 children have their own needs, their own sensory needs. There's some overwhelm, there's some sleep dysregulation, maybe there's some
Yeah.
eating dysregulation. So nothing that anybody would diagnose. None of them even have an ADHD diagnosis yet, but maybe one of them may get one if they pushed for it.
You say ADHD?
Maybe an ADHD diagnosis. Obviously, it's not my place to make the diagnosis, but mum's pretty convinced the 5-year-old may get an ADHD diagnosis.
Yeah.
But I'm just, particularly if we're thinking about children, what I was saying to mum is life is hard for children nowadays. Children are exposed to a lot more than they used to be exposed to, whether it's through screens, whether it's things they're seeing out in society, things they're hearing through the news. So why might a parent, particularly a child that's not diagnosed with anything, Esther, why would I consider bringing my 4-year-old to you? People very often think, I have a diagnosis, I might need a psychologist. But I'm interested in most people that don't have diagnoses, but maybe just have struggles.
I think that's just a really important point. And I actually believe that the American model in some ways is a lot better because it's more preventative and proactive rather than reactive. So, you see your therapist every week and it's not stigmatized, is it? But
Yeah.
what I love about being able to work early in the child and family sort of life is that you can support them um, with school, education, their mental health, any physical health challenges before things get really difficult. And just support parents. I do a lot of parent consultations for sort of under 10s. It would, particularly under 8s, I would say you work with the parents more and just helping parents have additional strategies or tools.
I think that's a beautiful word, strategies.
Yeah.
Because it is quite hard. It's hard being a parent, isn't it? Like you,
Really
I've
is,
got 2
yeah.
children, vastly different in age, and I devoured the parenting manuals, but actually my 2 children are so different.
Yeah, yeah.
What would be a parenting strategy for one child is very different to the parenting
So
strategy of
true.
another.
That's what's so great about I think about unmet needs. So we don't always see what the unmet needs are in our children. We don't always have the time, or we're doing everything, working relentlessly, thinking we're doing everything we can. Or like you say, what worked for one child somehow doesn't work for another. And I think having those sessions with a psychologist, you can take a step back and really think about your family dynamics, home life, school life, work, the intersection between all those things. Are they actually working well for you? And what can we adjust? What resources can we add? What are the unmet needs? What is the child trying to communicate that maybe they can't because they're developmentally not able to communicate? Do they need an ADHD or autism assessment? We offer diagnostic ADHD assessments and autism screening. So we have
And I
the
guess
necessity
even
to
if
be
you,
clever.
even when, because a lot of parents sort of like, right, I've got to the diagnosis. Maybe they've been on a long NHS waiting. But actually, again, you and I both know, even that bit of paper, it's then, and then what?
I know.
And I think that, and then what is even more important than the bit of paper, isn't it?
Absolutely. And that's our dream. Our dream and our vision for lifespan psychology going forward. We've been selected to pitch through a partner of Lloyd's Bank called Foundivine for some investments and some grants. And my dream is, and we're kind of already doing this, but on a bigger scale, it's not just being left with your diagnosis, it's actually having the holistic support from different members of the team whether it's speech and language, occupational therapy, physio, education psychology, support for the parents, the child, play therapy, actually having all of that so that, yeah, you're not just left with your diagnosis. You've got a range of therapies that help you and your children to thrive.
I love it. I love it.
That's our vision. If
I
we get
think
there,
that,
we
and I
get there.
think that's the vision we all need to be working towards. Because there's a lot, I'm just at this moment, I'm still thinking about children and young families, like you said, maybe under 8s, under 10s. And I'm like, there's a lot of parents, I would say, are wrung out like a tea towel at both
Oh,
ends,
it's so hard though, isn't
trying
it?
to advocate for their children with very little resources.
Exactly.
And I actually only had a parent, I think her son was 11, just got to secondary school, so slightly older than that. I coped in a small little nurturing environment, made it to high school just in September, and was expelled within the first 6 weeks of attending school.
So sorry. That's
And like, I
terrible.
hear these stories, and it's, you put this child in, he can't cope with the sensory, can't cope with walking through the corridors, can't. And the school's answer is isolation, and then expelled. And the mum was like, what do I do?
It's awful. It really is. It's
And,
catastrophic.
and she attended the GP, and the GP said, yeah, you're looking at 3-year waits until he gets diagnosis on the NHS. And school, in this instance, sadly, don't really want to help because there's no piece of paper to back what, the behaviors of the child. There's no piece of paper to back it. So he's sort of been put in we'll put you in isolation because that's really
Doesn't
helpful.
make any sense, really, does it?
But how often do you hear this story?
Yeah, it's becoming too common, and the education system is bursting at its seams, isn't it? But also, I'm afraid that the rates of ADHD and autism are increasing. The detection, the diagnosis, but also I heard this statistic from Exeter University: 787% increase in autism diagnosis.
That's insane. And from a functional medicine point of view, I have to be thinking about toxicity. Some of it, whilst mom's carrying baby, have to be thinking about gut microbiome and really thinking about, functionally what we can do. So with that in mind, because we've got a very overlay between the way that we work. So I would say, as a functional medicine practitioner, my biggest tool is my spade. So I use my spade to dig, and I might look into gut microbiome, and I might look into nutrient levels, and I might look into genomics, I might look into toxicity. So I want you to think about, and we call that root causes in our industry, but you're root causes as well, aren't you? Now, not just specifically thinking about children in this instance, I'm kind of thinking about anybody. What does root causes mean to you from a psychological point of view?
Have you heard of this concept of intergenerational trauma?
Very much so, but maybe you can explain it to our listener.
Yeah, so this has fascinated me, and I think the moment that the penny dropped was when it was explained to me that I was an egg in my grandmother before my mum was born,
Yeah.
and I thought, "What?"
Yeah.
And I think there's something obviously about we talk about root causes, there's so many different ways of looking at it, but um, intergenerational trauma, so things that get passed down either genetically or socially or culturally or psychologically through our belief systems, our family dynamics, our thought processes. There's all those things. Um, and then trauma, how is stored in the body as well, I think can be a root cause, and stress through life events and challenges. But yes, I think trauma and stress is kind of where my mind goes, and maybe some of the intergenerational factors
And
as
I
well.
very much agree with that. And it's something as I feel more and more passionate and have a much greater understanding, albeit I'm not a psychologist, this is where my expertise ends and yours, we pass over, is I always believe wellness can't occur in an emotionally altered state. So when there's deep rooted trauma, when there is lots of emotions like guilt and shame keep playing into those cycles.
Oh, absolutely, yeah.
But again, society very much does shame us into, doesn't it? That belief system. So I think that's something that people need to have the kindness, compassion, skills, empathy of somebody working with them to try and unpick this emotional side to it. Because if not, there's me going, I'm going to put your gut microbiome back into balance. But actually, it's been proven that emotions such as guilt damage the gut microbiome.
Right.
If
That's
we're in this
amazing.
forever trauma cycle,
Yeah.
and like we said, carrying all the trauma of our previous generations, then actually it's very challenging to create that wellness environment. That's where we need to work collaboratively to bring that together.
And don't you think that societal pressures are just too much, especially with like cost of living crisis, obviously the global crisis with all the wars and political issues. So there's all of that going on.
I think,
Then
I
let's
think
have
there's
to
the
juggle.
Yeah, there's the bigger
Work.
picture. And then I would probably say on top of that, and listen, for any men listening, please don't think this is a criticism, but we're both women and we're both working moms. And I would say for us working professional mums, there's also that pressure of, your grandma may have had children and then she stayed at home and she looked
Yeah,
after the children.
that's for sure. Yeah, she did.
Whereas we've got this level of pressure that, we've got to be back in our size 10 jeans on the playground, looking super svelte, with hair all in the right place, hold down an amazing professional job, be an amazing mum with our kids in 27 clubs per week.
Oh, when they can't cope with all the clubs, their nervous systems aren't designed for the extremely long days that our work life demands. In order
But another thing to add to their challenges, that's interesting actually. Maybe we could go there a little bit more. So back to finish that question, I think particularly us women, I'm not arguing about men, but I'm just thinking about, because we're both women, actually, we are in a challenge. And then I'd just like to add to the equation, I'd like your opinion on this. Then we look at pictures on Instagram of everybody. No, well, I don't either.
especially when our AI generates, I'm like, no.
But everybody on Instagram's got it right. So therefore, that feeds into our inferiority, doesn't it?
Definitely, yeah. I'm being flippant about it, but this is a real crisis, especially for the under 16s, as we've identified other countries, they're banning social media for under 16s.
And I think I saw on BBC News, it was even being talked about today or yesterday about it in this country.
Yes, exactly. I think it's essential, to be really honest. And it's
So maybe we can think about that sort of, over demand of us as adults to be perfect. And then can we go down to back to children? Because you made an amazing comment. I work with a lot of mums whose children, maybe they're in, definitely not all, but maybe in private schools, maybe they go in football clubs, maybe they're in, extra coaching for 11 plus, and maybe they're, representing country level, or
of course.
their scheduling
Mm,
is huge
it
nowadays.
really is. It really is, yeah.
Now, I didn't have the most privileged upbringing. I may have gone to brownies once a week. Tea and brownies. And that was about my kind of, but now it isn't unusual for children to be in 2, even up to 10 clubs a week.
For sure, yeah.
So what impact do you think that's having on children?
I honestly think, looking at the children I've worked with and my own children, the nervous systems are underdeveloped and can't manage. And even you'll find with my little ones, they'll get a cold. If I leave my kids in school past 4:15, that's the magic.
That's the magic number, yeah.
Yeah, and one day a week it's early. It's 3:15. It's going to be 3:15 today. But yeah, it's their immune system starts failing them. They get stressed. They can't cope. They're not getting enough sleep. They're anxious about performance in various clubs. Um, but it's what a lot of parents need to sustain their high profile, high level jobs that they're doing. But I think, yeah, I do. And it's very difficult to give this sort of advice. And I do say every family's different, every child's different. I'm not going to be prescriptive on saying, oh, your kids must be home at 3:15. I'm not going to say that. Every child is different. But we have to evaluate at different ages and,
Stages.
yeah, what can they really take on and what is good for them developmentally? And then that may not always fit in with what your work schedule is or what your partner's work schedule is.
But it's about trying to work on the needs of the whole family, isn't it? And some of the time, like I said, I absolutely get this, but some of the time it's like some of the time we're making choices based around our childcare requirements. Some of the time we're making choices around what we think is right for our child. Lots of clubs and lots of opportunities and lots of, and actually is not always the right sort of thought process, isn't it?
And I think our bodies keep the score, as the book says, a friend's book. And it's same with our kids as well. And their bodies, even if they can't tell you, you'll start seeing in behaviour, you'll start seeing in them getting, sadly, physical illnesses and so on. If their immune systems and their bodies are being pushed to exhaustion, I think, yeah, you'll see through other ways. It may manifest in things like OCD. I've seen this as well. Anxiety, social anxiety, low mood, perfectionism, all these kinds of things.
Yeah. And sometimes the symptoms are a little bit subtle before it becomes kind of a big problem further down the road, isn't it? Like maybe a child's getting sick all the time, then maybe a child's got a bit more anxiety, then the OCD or the
Yeah,
whatever
exactly.
comes.
Represent that cascade of events.
Absolutely.
Yeah.
Now, the last area I really want to go into is an area that I'm incredibly passionate about. When somebody comes to see me for a functional medicine consultation, I do my dig down deep, might talk about dietary recommendations, particularly focus on what else to put in, because my mentality is what should we put in, not always what should we take out. Because you take something away from somebody and they want it more, like, no sugar, and they're like, all I want is sugar.
Yeah.
Whereas actually, can we focus on putting fiber in, and then maybe that will help to regulate your sugars?
Yeah.
So when I'm making my recommendations, I split those recommendations. As you know, you should work with me for years. What do we need to do with food? Where might food not meet the gaps, and maybe supplementation? What testing can we consider? But there's another big area that I rate just as highly as food. This is me personally, and that's lifestyle medicine.
Oh, yeah.
Now, so I would say you can't eat yourself out of a stressful lifestyle. You can't supplement your way out of a stressful lifestyle. And that's why I see lifestyle medicine as such a big, big part of my recommendations to people.
Definitely. Yeah.
Now, for me, lifestyle medicine it might include sleep hygiene, number of hours of spending in bed, might be time outside with nature, laughter, connection, mindfulness, meditation. Like, these are some of the things, but I'd like you, from your point of view, maybe this is somebody who's coming to you, no diagnosis, just stress, wrung out,
Of course.
overworked. What sort of things would you categorize as lifestyle medicine that you might be able to support them with? Because one thing educating, the other thing is kind of support with those things, like accountability, isn't there?
I think this sort of boom and bust fatigue cycle that we can
Yeah.
get ourselves in with overwhelm, and actually like mapping out the kind of activity levels and behaviors and what's happening in a week, and really taking a step back and saying, just kind of reshaping and redefining what you're doing day to day, and even working smarter and not harder. So I will coach, business owners, or I'll coach clients to think about their lifestyle and what adjustments they can make where they get more done, but using less time. I love all those life hacks.
Love it. Love it. And taking away distractions, isn't it? I sometimes say to people, how often do you pick up your phone?
Exactly.
Actually,
Procrastination.
take
Yeah,
the focus
procrastination is a big one to work.
out of the. And you said a word, and I'd love to, bring back to that more the coaching side to it. So people wouldn't necessarily think coaching a psychologist in the same concept or the same sentence, but actually you just use the word coaching in your psychological support for people.
Yeah.
What does coaching mean for you, and how can that be? Because one thing, telling somebody something, it's another thing than being able to roll with it, isn't it? So where does the coaching side to it come in?
I think the coaching is kind of more looking forward and goal focused and smart goals, solution focused, and focusing on like now and the future, kind of where you are now, where you want to get to, building that motivation. Whereas therapy is sort of looking in your rearview mirror and looking past. I think I would
I love
driving analogy.
and actually sometimes therapy can be useful, and I've done both. Sometimes therapy can be useful to help you to understand why. But actually in my opinion, you reach the end of keep looking back because you don't change the past, do you?
Yeah, of
It's
course.
our understanding of what we've looked back on to work on the future.
Exactly. Yeah.
I love
That's when you
that.
kind of go more in coaching mode then.
So my last question for you is there anybody who can't benefit from your services?
Oh, I'd like to think that they could. We're online, we're in person. Anybody who couldn't. Well, I always refer them to yourself, Joe, if they can't. If it's something
But if nobody thought
physical.
it from a mental health diagnosis on the provisos that, they've got their GP care, they've got their medication reviews, all of those sorts of things, if they're on meds,
Mm.
there's nobody that you're like, no, they couldn't work, they couldn't benefit from support.
I think that if the person's having an acute mental health episode and they need to be admitted to hospital, inpatient ward for their mental health, then we won't be able to see them until they come out of hospital.
Yeah.
We don't provide a crisis service and we don't work with acutely unwell people, but we will work with the family members. So,
Perfect.
and that can indirectly have such positive effects because I love working systemically as well. Some of us work systemically, so we could work with the partner or the children or the family to support when the person's gone into hospital.
Yeah.
Because I think that's really valuable because reducing carer stress can have a massive impact on
Absolutely,
trauma
it
as
can.
well.
And I know myself that I supported people from a functional point of view, post-acute support. And again, I've watched parents kind of go into, what did I do wrong? And actually, it isn't about what they did wrong. It was about that young person in this instance had an acute episode, and actually they're doing an amazing job of holding space for that youngster, but they needed that. So that would
They needed that support and reassurance and validation. Validation is so important when we're in a crisis or life is challenging. We can sometimes think there's something we've done wrong, but actually it's that validation we need that this is really hard and you're doing amazingly well considering the circumstances. And I think that's what carer support is, isn't it? It's
completely.
yeah.
Well, listen, thank you so much for your input. I think it's certainly given me food for thought. I think it's given our listeners food for thought about how our services work so beautifully, so collaboratively. And actually, sometimes seeing a psychologist may hold a bit of a stigma, but actually, there is no stigma attached. And like you said, in America, I've got lots of American friends. They say, Joe, we all have college funds, we all have therapy funds for our kids. And yet in this country, there still is a bit of stigma associated with it. And I always say, I am the best therapist I can be because of all the therapy I've had. And now because of all the coaching that I do. So,
Of course.
uh,
I really think it can make you a better person,
and
like
I
in
100%.
terms of whether it's your performance at work or as a partner or as a parent or
Yeah,
it
100%.
yeah.
Yeah,
It
I love it. So thank you so much for your time today. It's been lovely to talk to you. And I look forward to keep working together.
Yeah, me too.